No, I'm not.
Talking?
Rick is.
I'm going to say two words. Anything you want to say? Yeah.
Help me understand.
Yeah, everybody I think is saying that.
Yes, I'm through Ramsey County. You care. You know, the unions. Yeah, Teamster, Chris.
That's good. I think it's coming to a head again. And more, we're gonna have.
She's out in Stella.
We're gonna go.
You know, hot rod.
Oh, yeah?
Yeah.
Should be.
Yeah. Leave it to Chris.
Yeah.
Yeah, leave it to Chris. Okay, well, to the side over here.
All right.
With you? Oh, that.
Okay.
Okay.
Good afternoon to you folks here in the auditorium and all you folks who are in the apartments. We don't know how many are in the apartments, but I hope that quite a few of you are. We're here today because we don't want to be here. Unfortunately, for most of us who are in UCare and have had UCare insurance, I had it for about a dozen years. So we are being forced out. We need to find a replacement. I think there are good replacements, but we need to learn what the alternatives are. So the purpose of today's gathering is to get some general information and to learn. We have a presenter, Connor Coker, who is experienced in this business. This is what he does. I'm going to suggest that as we go through, or he goes through his talk, that if you have questions, you jot them down. He's going to have a presentation, a format, things he wants to cover, and he very well may get to your questions sometime in his presentation, but he will give us time for asking questions and to answer them. So I think other than that, I think we can go. Connor, you got the floor.
Hi, Rick. I thought he was going to give me a chance to say hi. My name is John Dunlop. You might know my wife, Susan, who's down in the care center. I'm here quite frequently with her. And the men's group have kind of recruited me to try to find a speaker for today. Rick already mentioned that this is really primarily aimed at people who have been insured by UCare, and I'm wondering how many of us have been. And how many people have been insured by a different Medicare Advantage program? Oh, with different providers. So that's really interesting. I guess, and how many people, I guess it would be mainly from UCare, have received your plan termination letter? Let's reverse that. How many from UCare have not received it? From
The county, Ramsey County, and they put us on UCare. I'm expecting to be on.
let's let Connor tackle that one when he's speaking. I think because the termination letter is the one that really authorizes us to switch plans without any questions asked. And Connor will be explaining more of that. Another question: how many of us get our? This is a little biased. That's okay. Get our drugs from St. Paul Corner Drug. How many can? St. Paul Corner Drug. How many use? Yeah. Okay. How many can somebody? No. How many people know the owner or the pharmacist? And Don, what's his name? John. Oh, it's also John Hoshin. St. Paul Court and Drug has a number of brokers who can help us make decisions about which program to move to. And in fact, there was or is or was a list of them on the table over there. There's still some there apparently. You're welcome to pick that up. One of those persons is, as Rick says, Connor Coker. And Connor comes highly recommended by John Hoshin. And so that's been a real major advantage for us. Let's see. I can't read my writing. Oh, yes, I was going to comment that there's been a change this year. Up until very recently, the insurance companies would allow brokers to represent us and sign us up for our insurance program, or for their insurance program. And the broker would get a commission. They've discontinued the commission. We still, well, at least for many of the plans, and Connor can elaborate. But what that not for all of them, but what that really means, is that Connor's time here with us is really volunteering for us as a senior community to educate us about the options that are available. We are, thanks to Marty, recording this session so that you can check out what Connor says later. But it also means that we need to make sure that we ask all of our questions using the microphone, and please keep it close to your mouth. With that, Connor Coker.
Thank you so much, John. Thank you. So I really want to make this more of a conversation than a presentation, but I'll start off just by letting you guys know some of the things that I know about UCare going out. So UCare isn't leaving the state. They aren't going out of business entirely. They are dropping their Medicare Advantage plans, and they are still keeping their supplements. So if you have a supplement with UCare, you're safe. In fact, if you have a supplement at all, supplements have a guaranteed renewal, so this cannot happen to you. You cannot just be tossed off of a supplement plan. Absolutely. Let me start off talking about the differences between Advantage plans and supplement plans. So when you have a supplement plan, what you have is a supplement to Original Medicare Parts A and B. So that's actually important to understand what Original Medicare Parts A and B are, what they cover and what they don't cover. So I'm going to briefly break down Parts A and B of Original Medicare. Many of you already probably know what they cover, but just to start, Part A covers hospital and hospice. Part B covers doctors and nurses services, and that actually covers Part B drugs too. And what Part B drugs are is they are drugs that are administered to you by a healthcare practitioner. So it still falls under that service coverage. That is not prescription drugs like what you would pick up at the pharmacy and administer to yourself. Part B also covers durable medical equipment, and that is everything from CPAPs to wheelchairs and a lot of other things that fall under that category of durable medical equipment. So Parts A and B, they cover different things, but they also have different premiums. Many of you will pay the $185 monthly premium for Part B, and most of you will not pay any premium for Part A. And if you have questions about that, specifically about your situation, how much you're paying for Parts A and B, feel free to talk to me afterwards. Some other things are that Parts A and B have gaps in them. So Part A has a $1,676 per occurrence deductible. And what I mean by per occurrence is, as opposed to per year, With a per year deductible, you pay it once a year and it's gone until the next year. What a per occurrence is each time that you go into the hospital, you will pay to that deductible, and then you have 60 days, 2 months of a refresh period where you're outside of the hospital. And if you hit those 60 days outside of the hospital and you go back in again, you have to pay that deductible once again. So that is under original Medicare. And then Part B, you have a $257 yearly Part B deductible. And then after that, you have a 20% coinsurance with no ceiling on it. There's no maximum on that 20% coinsurance. So that is the basics of original Medicare. Now with those large gaps, like especially the 20% coinsurance where there's no cap on it, that's where supplements come in. So what supplements do is they supplement original Medicare. That's why they're also called Medigap plans, because they fill in the gaps of original Medicare. So when somebody has a supplement plan, they have parts A and B of original Medicare, and the supplement fills in the gaps. It supplements original Medicare parts A and B. And that's why supplement doesn't cover prescription drugs. They do not cover prescription drugs like you would pick up at the pharmacy. That would be covered under a prescription drug plan if you have a supplement. And when you have a supplement plan, you get what's called a separate or standalone prescription drug plan. And it's called that because it is not tied to your supplement. They are entirely separate, and you can actually get them with a different company, and you can switch your prescription drug plan without touching your supplement plan. How that's different from Advantage plans is that when you have an Advantage plan, you're no longer on original Medicare parts A and B. That is not your insurance. Your insurance is actually a private health insurance plan where Medicare pays a company, a private company, for you to be on their plan, and they pay a certain amount each month. Don't know exactly what that amount is because it changes based on the company and the plan, but they pay a certain amount for you to be on their Advantage plan. And Medicare lays down some of the rules that these Advantage plans have to follow, and they give some of the money that they need for providing the plan for you, but they do not have the same control as they do when you have original Medicare. And what I mean by that is these Advantage plans have the ability to do prior authorizations, which is the biggest thing. They can require referrals, and they can also limit you with a plan network. That means that you have to go to their doctors, or in the case of a PPO, which is a preferred provider network, you can go outside of their providers, and you might pay a different co-payment or co-insurance, but you still are limited essentially to their network if you want to pay the standard co-pays. So, does anybody have any questions on some of the differences between supplement plans and Advantage plans? Yes.
About Part D Medicare, the pharmaceutical coverage.
Yes. So, do you have any specific questions on it? Yes. Part D covers your prescription drugs. So it covers drugs that are not administered to you by a healthcare practitioner. So when you have a supplement plan, your prescription drug plan is separate from your supplement plan. On the Advantage plans, it's built right in. They're all together in the same plan. So if you change your Advantage plan, you also change your prescription drug plan side because they're completely tied together. But a prescription drug plan covers you for your prescriptions that you pick up. And you could be paying a copay, a deductible, and they have different tiers. And each of the prescription drug plans has a different formulary for what prescriptions they break down into different tiers. So tiers 1 and 2 are generally generics. Tiers 3, 4, and 5 are usually brand name prescriptions. Yes.
Just wondering if they. Okay, I was just wondering if the prescription, drug plans that we may now have or may have in the future, is that explained to us by our doctors when they prescribe? Because how else will we know when we go to the drugstore, if we're not gonna sync in what our payment is, if everything is going up, really high?
So I don't think that there's any requirement for the doctor to check on how much the prescription is going to be. Was that kind of what the question was, for how much the prescription was going to cost? So maybe if you have a really good doctor, they would go and check and help you with that. But Medicare.gov is a really good place to go. So Medicare.gov, you go to Medicare.gov and you can see all the different health insurance plan options. And you have to make sure that you have the right year. So right now you'll see that you can look at the plans for 2025 and 2026. And so just make sure that you have the right year put in there, and you put in your zip code, and you can look at all of the different plans that are offered in your zip code. And so if you need help figuring out which plan that you have, you should have a card, and there should be a phone number on the back of your card that gives the customer service line for your plan. Give them a call and they will be able to help you with figuring out what plan it is that you're on. And they may even be able to help you figure out how much that prescription is going to be. But yes.
I'm not very smart about this stuff. So should I get Part D? Or should I just get a separate drug plan?
So,
Or are they the same?
yes. So Part D is, I should just define terms a little bit. Prescription drug plan and Part D are synonymous. They mean the same thing. Yeah, so when I say to get onto Part D or to get a prescription drug plan, that's just talking about getting onto a prescription drug plan. And then how you do that is different for if you're going to go with an Advantage plan or a supplement plan. Absolutely.
Connor?
So why was it so important to get that letter that says, if you don't stay on an this is your one-time offer? You know, it makes me feel like for some reason, certain kinds of people are going to want to switch. I mean, I don't understand why that was such a scary sounding letter.
Yes. Let me explain what that letter is and what it does. So when people get onto Advantage plans, originally when they're signing up for Medicare, they oftentimes don't have it explained to them what the differences are between Advantage plans and supplement plans. And they also aren't told that down the road, if they get onto an Advantage plan or they just don't do anything at all, they don't get onto either Advantage or supplement plans, they may not be eligible for a supplement later on. So that letter gives you something called a guaranteed issue right. Everybody has a guaranteed issue right when they first get onto Medicare. And so what that guaranteed issue right does is it allows you to get onto a supplement plan without any kind of underwriting. What happens if you don't have that guaranteed issue right is that you have to do what's called a health assessment form. And that's a form where they ask you all kinds of questions about your health history. And if they don't like your answers, they have no obligation to enroll you into the plan.
So if I was on a PPO plan and they decided not to have that plan anymore, would I get a letter saying that I can never be on another PPO if I don't do it right now?
So with the PPO plans, those would all be Advantage plans. And so you can always go and enroll onto an Advantage plan, but supplement plans are different. Supplement plans, they're allowed to restrict who can get onto the plan. And so that letter was specifically about supplement plans. You would absolutely be able to get onto any Advantage plan that you wanted to as well for next year, but that was specifically giving you a guaranteed issue right to get onto a supplement plan, which you may not have down the road if you decide to pass up on the opportunity.
on the same topic, there's obviously an advantage to the insurance companies to have you have a Medicare Advantage, right? And they also get more money the sicker you are, am I right?
So they were getting more money the sicker that you are. So they had certain questions that they would ask you, and based on those questions, oh yeah, did you have okay. So based on your answers to questions that they had been asking people, they started receiving more money, and that actually created some scandals. And I'm sure that you guys have heard about them. I'm not going to go too much deeper into them here, but that they were getting more money based on the answers that people gave to those questions.
I have a question.
Yes.
Can you explain to me, first of all, I'm blind and I don't know that I received any letter like that. And it would be up to my partner who isn't here to let me know. But my question right now is that I'm a member of the Ramsey County insurance plan, and they have United Healthcare, and then my doctors are all through Health Partners. I don't, are you telling me that United Healthcare is leaving without telling us that?
So that's a common, name association between United Healthcare and UCare. They're actually different companies.
What are we talking about?
We're talking about UCare, not United Healthcare.
Oh, my God.
That is A-okay. It's very, very common. That is very common.
So does this, any of what we're discussing today, which sounds very scary to me, is any of what we're talking about today affecting those of us who are on the county insurance? No, I'm just, good God, I can't even remember what I am.
So
Healthcare is what we are.
So it shouldn't, but there are some plans in other counties that are being dropped. So it really is up to your particular situation. There are Health Partners is dropping some plans, Humana is dropping plans. You have a lot of companies that are dropping plans within certain pockets of different counties in Minnesota. And so it really is up to your particular situation. And one of the best things to do would be to contact your company. There should be a phone number on the back of your card, but I would be able to help you to try and reach out to them and see what we can do to figure out your specific county plan.
Thank you very much.
Happy to.
Thank you for coming. And I apologize for coming late. Maybe you already talked about this, but I was on UCare for Seniors and I got the letter and no help. So I contacted someone who said, talk to this Brettenfeld group, and I sent them information and they replied saying they would recommend Blue Shield, Blue Cross, and they quoted a premium. I have no way of knowing comparatively where I am, if that's a good thing or a bad thing. And maybe you have given a ballpark figure for what premiums would be across the board, but that's a significant issue for me right now.
So if you would like, we can talk about that afterwards, just because there's such a huge range given that you might be they might have sent you an Advantage plan. They might have sent you a supplement plan. I don't know what it is that they sent you. And I'd be happy to take a look at it if you would like me to.
I can go get it. I don't have it with me, but I can get it. Yeah.
But many of you have probably reached out to agents and brokers, and you might have been even turned away. And one of the reasons for that is that many of the companies are not paying us a commission. They're not, and many of them aren't letting us be the agents on the plans. And so for a lot of agents, they said, well, if you're not going to pay me for most of these, I'm not going to give my services then. And so, that might be what's blocking a lot of you. Maybe you guys lost your broker because you contacted them and they said that they're not going to help you anymore. But that's the reason. I've had many people with different situations where they just say, well, I tried to contact my agent who I've had for 20 years. And I just was told that they're not going to help me this year. So
before this last discussion, I think you were talking about some underwriting. Obviously, I'm in a wheelchair and I'm an obese woman. And so they have to accept me this year. They're not underwriting me. Is that correct?
So if you received that letter from UCare that says that you have a guaranteed issue right, you are correct. They have to accept you. And this is what I've been told by a number of companies. They are only required to give you a basic supplement plan. And don't think that by the word basic, it means that there will be not much coverage. That's just a plan type. Supplement plans are standardized in Minnesota. You have multiple different plans. The most common are the extended basic, the basic, you have the $20, $50 copay plan, you have the high deductible plan, you have the 50% coinsurance, 75% coinsurance. So you have a lot of different plans. But I've been told by multiple of them that they only are required to give people a basic supplement plan, and you can add on what are called riders to that. And we can go more into what that is and what that means, but you would be able to get onto a basic supplement plan with riders. Absolutely. And they can't turn you down. And they can't even ask you questions about your health.
As for my prescriptions.
So the reason that
That concerns me.
Yeah. So I'm not sure what the context was to them asking you your prescriptions, but if somebody was trying to get onto a supplement plan without a guaranteed issue right, they are allowed to ask for you to state your prescriptions in order to get onto the plan. Or it might have been that they were looking for a prescription drug plan for you and they were trying to see which one would be the best premium cost for the cost of the prescriptions. Absolutely.
Connor, I'll just follow up. You raised the question of not getting paid for your services. Does that apply to all of the insurance companies or just some of them? And I think for our information, which companies are not reimbursing you? And do you have any idea why they've changed their approach?
So a big part of the reason that they've decided not to pay us, and this is just what they tell us, is because of UCare going out of the Medicare Advantage space. And because of the fact that that frees people up to go anywhere that they want. And so what the companies are worried about is getting an avalanche of people joining their plans. And just the reason is that many of them are losing money. And so they figure the more people that we bring onto the plan, the more money that we're going to lose. And so that's the reason why they don't actually want people necessarily getting onto their plans right now. That's why they're deciding not to pay us. United Healthcare for the supplement plans and Health Partners are the two that are paying on the supplement plan side. Allina Aetna is paying on the Medicare Advantage plan side. And to my knowledge, those are the only companies that will be paying for the Advantage plans and the supplement plans.
Blue Cross and Blue Shield is what?
That was my fault. Okay.
I forgot what I was going to ask.
Oh.
Oh, I was out of order. I'm sorry.
Question will come back.
All right. Cross and Blue Shield is paying my insurance broker, but I have original Medicare. So, you know, I was able to get a hour-long, you know, seminar on Zoom or whatever with the insurance broker. They're getting paid by Blue Cross Blue Shield.
Do you mind if I ask your situation? Are you starting onto Medicare?
No.
Okay.
No, I've been on original Medicare for 10 years because I thought Medicare Advantage was I don't want to get into.
Did you switch plans then? Okay.
No, I don't need to switch.
So what I should say is that for renewals, they're all still paying, but for new business is where they are not paying. I should have clarified on that. So for bringing on new clients, they are not paying.
Okay, we'll go here first and then behind you. Go ahead.
I was just wondering, Now, I have the Blue Cross Blue Shield, federal employee, whatever, and then I have that supplement. Now, that's good to stay where it is, from what you're saying.
So you have a Blue Cross Blue Shield supplement. Is that, so what, could you explain exactly how you understand your plan? Is it a Blue Cross Blue Shield supplement plan?
It just says Blue Cross, on my card, it says Blue Cross Blue Shield Federal Employee Plan. And that's what it says, but they pay on my prescriptions and whatnot without going to having separate plans. But now, is it required for me to have a separate plan for prescriptions?
So if your plan is just one card, chances are you're on an Advantage plan. If you're using that card for both your medical services and your prescription drug services, chances are you're on an Advantage plan. So it's up to you whether you would like to or not. It sounds like you didn't receive a letter telling you that your plan's going away. So you'll be re-enrolled next year then if you haven't received that letter. But you absolutely can keep it, or you can look into the option of supplement plans, but you would have to go through the health assessment form. Absolutely.
What is original Medicare?
Absolutely. So original Medicare is parts A and B. And do you want me to kind of break down parts A and B?
No, you did that before,
Oh, okay. Yeah.
but I mean, is there some, what is original Medicare in distinction from what?
As opposed to an Advantage plan.
Oh, okay.
Yes.
All right. And Advantage plan, what's an Advantage plan?
So an Advantage plan is a private health insurance policy that is given to you, and for Medicare Advantage plans, they are paid a certain amount from Medicare for you to be on their plan. Sometimes you also will have a premium payment. And what it means is there's a private health insurance company that's administering your Medicare benefits.
And that's UCare, right?
For you, it might have been UCare, but UCare is going away on the Medicare Advantage side, and you might have received that letter.
I did.
Yes. So were there any other questions kind of about how Advantage plans work or?
No.
Okay.
Connor, isn't the original, like what we refer to as original Medicare, isn't that simply the government Medicare program as passed by the U.S. Congress that's been said that we're all entitled to?
Yeah.
The original, it is original, but it's what we all basically have. The Advantage plans are actually the government paying a company, as Connor said, to provide the whole gamut of things.
And it's a replacement. So an Advantage plan replaces your original Medicare. And the reason that I'm so careful about the wording is because when I say original Medicare, the Advantage plans are allowed to use the Medicare term, but it's different than original Medicare. And so oftentimes people hear that Medicare Advantage plan and they say, oh, that's got to be the same thing as original Medicare, but it's not. It's not the same thing. So that it completely depends on what your situation is. But you have prior authorizations involved on Advantage plans, which can be really difficult. And we can get more into whether that would be the right thing for you or not. But because of the prior authorizations on Advantage plans, as well as sometimes requiring referrals and having plan networks, many people consider the supplement plans to be superior. And because you have original Medicare.
Hi, I'm here helping my mom. She has had UCare and did indeed receive the letter. She has had fantastic coverage, drug coverage in particular, and that is of utmost importance to us. But we have to make a different decision if she received that letter. Is that correct? Is that how I'm understanding this?
Yes.
Okay. Okay.
So from the situation that you have described, it sounds like you probably won't receive a letter because you likely aren't losing your plan. I'd have to know your full situation, but you probably will not receive a letter because it sounds to me like your Blue Cross plan is not going away. And I can't guarantee that, but you can.
Here's one, Connor, back here.
Yes.
Are all Advantage plans for-profit companies?
So not all of them are from for-profit companies. So you have Blue Cross Blue Shield, Medica, Health Partners.
Okay. Do these Advantage plans get our complete Medicare deductible? The money out of our Social Security? Do they get the complete amount?
When you say the complete deductible, do you mind if I ask, do you mean,
What's taken out of our Social Security for Medicare?
yes, if you're on an
Does the
Advantage plan,
get
that will go
that
to them.
total amount?
Yes, if you're on an Advantage plan, that will end up being directed to them.
Thank you.
Absolutely.
Okay, maybe in the front row here, and then we'll go to the other side.
Just a quick comment. The people who Mary left and worked for Ramsey County or federal government, if you didn't get letters, and you correct me if I'm wrong, it means that you're under a different plan. And if you're at all concerned, call your employer, call the Human Resource Department. They will tell you whether or not you have any issues to be concerned about. But who you are talking to today are those of us who have individual plans not associated with any prior employment.
Right. There are some people with employer plans who did lose their coverage too, though.
Okay.
So for some people, they might have lost their insurance even though they're on an employer plan.
So I think I heard you say that many people consider the supplement more advantageous because it doesn't require a pre-authorization. Can you tell me about the implications of requiring a pre-authorization? I don't even really know what that means.
Absolutely. So what a prior authorization is doctors oftentimes have to get approval from an insurance company, the insurance company that's providing the insurance for their patient. They have to get approval before they can go ahead with a procedure that the insurance company will indeed pay the specific procedure. Would you like me to give somewhat of an example? So let's say that there's two patients with the same back problem, and they both go to the same doctor, and that doctor has two procedures that they can think of that would be advantageous to help with the back problem. One of them is on a supplement plan and one of them is on an Advantage plan. How the doctor will handle the individual with the supplement plan is they'll say, okay, well, is this covered under original Medicare? And for the two surgeries, let's say that one of them is a $100,000 back surgery, and it's really, really top of its class. It's fantastic. There's no complications that will be involved. And the other back surgery is a $50,000 back surgery, and it is not as good. It just doesn't, it's not as effective, and there could be some complications that the doctor knows about. And so the first patient who has the supplement plan, all the doctor has to do is say, is this covered under original Medicare? If the answer is yes, he will submit the payment for that $100,000 back surgery, and it will get paid for by original Medicare. And then original Medicare will tell the supplement plan how much they have to pay, and they just have to pay it. And they can't ask for a prior authorization. So they can't deny you coverage or anything along those lines. The only question is it covered under original Medicare? If yes, then the doctor is good to go. They don't have to answer any questions about the plan. Let's say that the other patient is on an Advantage plan. What happens there is the doctor has to fill out forms for answering questions to the insurance company saying, this is why I think that this surgery is the right one, and would you please pay on it? And so they send that into the insurance company, and the insurance company is allowed to say, well, doc, we know that this $100,000 surgery is what you ordered, but we actually like this $50,000 option because it's very cost effective for us. And so those prior authorizations can cause delays when the insurance company doesn't get back in time. And they also obviously can lead to denial. But what most people don't see is when they dictate your coverage in the sense of making you go with the $50,000 back surgery instead of the $100,000 one, as in the example. Absolutely.
Connor, thank you so much for coming today and helping us alleviate some of the anxieties and come to some kind of understanding of our situation. This whole thing looks like a house of cards to me. I mean, it probably won't collapse in my lifetime or for most of us in here. But for a lot of people, it's collapsed already and it's collapsing day by day. You may not want to venture into the politics of this, and that may not be what you're about, but I would appreciate hearing your thoughts on that. You know, is there a way out of this house of cards for our society or not?
Maybe not for society, but for an individual, yes. And the answer is to be on the supplement plans. Be on the supplement plans.
But there are a lot of people that's not an option for.
Very, very true. Exactly. Yeah.
I've been on UCare Advantage, and for several years I've wanted to go to Original Medicare, and the primary reason is I've become aware that the Advantage plans are a way of privatizing Medicare, basically, and giving the profits, even though it's a nonprofit company, the CEOs are getting plenty of money at the nonprofit companies too. And so it's a way to take control away from the government and put it in private company hands. So for me, that termination letter was a blessing because it gave me guaranteed issuance that I could get back on Original Medicare. I wasn't sure if I would be able to before, and I never tried. I didn't go through the hoops. But so I was able to get on to a supplemental plan for next year without having to answer the medical question. And
That's
to feel
fantastic.
better about where my money is going. So
It's fantastic. Thank you.
Yes, I had already decided to go back to the original Medicare and the supplement. I did have the UCare Advantage plan, but now I'm trying to compare and I come across things like PPO and HMO. Can you tell me the difference between those two things?
So a PPO is a preferred provider organization and an HMO is a health maintenance organization. When you have an HMO, it is a lot tougher to go outside of the plan's network. With the PPO, they give you the opportunity to go outside of the network, but you oftentimes pay a higher cost to do so. Yep. Any other questions?
Unfortunately, I got the time wrong, so I came in late. And quite frankly, I don't understand very much of this. I understand poetry a lot better than I understand insurance. And I did have a broker who recommended that I just move over to Blue Cross and Blue Shield. What do you think of that plan?
So with moving over to Blue Cross Blue Shield, it depends on whether it's an Advantage plan or a supplement plan. And we went over a little bit of that today. But if you would like, you can come up, maybe we could talk afterwards about some of the differences between Advantage and supplement plans.
Okay.
Yeah.
Thank you so much.
Absolutely.
Maybe I'll just jump in and remind folks, so if you go onto the CSJ YouTube channel, it'll say Friday afternoon CV program. You can watch and catch the beginning of the conversation today, or if you want to review your notes that you took and want to just look at it again, you can go back and watch the video.
All right, so we're most of us switching over to
supplement plans, which means selecting a Part D plan for drugs, a separate drug plan, or for those of us already on supplement plans, we have a drug plan choice or choice to switch. If you're on a drug plan and the price goes way up, are there downsides to switching to a different drug plan that has the same formulary?
So it depends on what kind of copays and coinsurance that they're going to charge you for your prescriptions. If it's the same formulary, then it might be a good opportunity to make the change at the end of the year. But what you want to do is go on to Medicare.gov and plug in your prescriptions and take a look at how much they would be on either plan. So you look at, and you can compare them side by side with the two different prescription drug plans, and you can see whether the increase in the premium is going to be worth it for you to stay, or whether it might be more beneficial to go on to the other drug plan.
Okay, well, in my particular case, I hit the annual max catastrophic coverage in January with all the plans.
Gotcha.
But it requires, they call pre-authorization. Am I going to have a lot of trouble with that?
It requires, you said prior authorization?
Well, I believe that's what it's called.
Okay, so you have to get the drugs approved by the, so did you already, we can kind of get more into your specific case scenario, but did you already get it approved for 2025 then? And now you're thinking about rolling over?
But it was approved for 6 months.
Yeah, okay. So we'll probably want to talk about that particular situation one-on-one if you'd like.
Okay.
To clarify for folks who got this scary letter from, getting kicked off of United Healthcare Advantage plans.
You care.
You care,
Yes.
when you're not, you care
Advantage.
Advantage plans, and thank you for clarifying that. This lady over here just said that she could then get back onto original Medicare with no prior authorization required.
Right.
Is that true for anybody in here?
For the people who are losing their UCare Advantage plans, they have the opportunity to move on to a supplement plan with a guaranteed issue right.
That's a good deal.
Yes.
It's a very good deal.
Absolutely it is.
Do it.
Yeah. Oh, 100%. Yes. Absolutely.
Okay, well, again,
Looks like there was a question over here.
Are you familiar with the Ramsey County employees, retirees plans being offered?
I've looked the plan over before. I don't offer it. But is there a particular question about that plan?
This is our last year contract with United Healthcare, apparently. And those of us who last year went off plan, which was an option given to us because they weren't playing very nice with health partners. So we, going back onto it now for this third year, are you suggesting or have any thoughts about being on the supplemental plan versus a premium plan or anything in that?
So whether to be on a supplement plan or an Advantage plan?
Yeah.
I personally prefer supplement plans because you don't have to deal with the prior authorizations. And so in your situation though, you may have to do a health assessment form. So that's the one thing that could end up becoming a roadblock, but I think it's still worth it to try to get onto a supplement plan.
Really? Okay.
I have a follow-up question. I'm a little unclear as to Dave's question about being able to go back to original Medicare. But make sure I understand it. Original Medicare is a government program, but it's to be fully covered, you still need to have either an Advantage plan or a supplement plan. It isn't just original Medicare and nothing else.
Original Medicare by itself has those gaps that we talked about earlier with the hospital per occurrence deductible and the 20% coinsurance. And you're exactly right. So what you do is you fill it in and you can fill it in with the supplement plans or replace it with an Advantage plan. Yes.
I had met last year with a broker and I had specifically stated I did not want Medicare Advantage. And she put me on Blue Cross. And I think it was Blue Shield as well. But I had to take, she really just said, what's wrong with Medicare Advantage? And I didn't want to get into that, but could I get a Blue Cross, Blue Shield policy in addition to the real Medicare?
So for people, I should give a little bit of a broad answer here. So there are people who get onto an Advantage plan when they become eligible for Medicare, when they first enroll into Medicare Parts A and B, and they have what's called a 1-year free look-back period where they're able to move on to a supplement plan with a guaranteed issue right for that year. Outside of that first year with the guaranteed issue right and losing your plan, there aren't other ways besides losing your plan coverage by maybe moving outside of the state or outside of your county. But you were saying, is there a way for you to move from that Blue Cross Advantage plan over to a supplement plan without going through a health assessment form?
And still keep the Blue Cross.
So if you can apply to get a supplement with Blue Cross, you may have to fill out a health assessment form though. And you could get denied. That's another thing that I should say. So they do underwriting. They look at all your answers to the questions on the health assessment form, and they are allowed to deny you based on your answers. So that's a supplement to original Medicare. That can do that, the supplement.
So just listening to what we hear today, and we're all reasonably intelligent people, I agree with Dolores. I think what we need is a revolution in this country. So people our age don't have to deal with this.
Thank you for sharing that. Yeah.
With that, Marty, you want to bring it up?
Just to
maybe one more question, Marty.
If you switch to a supplement plan this year,
Yes.
could they deny it next year?
No. So supplement plans are guaranteed renewable. So they can't kick you off of a supplement plan once you're on it. They can stop allowing people onto that supplement plan, but they can't just kick you off. If you got the guaranteed issue letter, yes, you can. Yes. Yeah. Yes.
What about people that are in their employer plan? They had no choice. The employer went with an Advantage plan. So we cannot go back to the regular original Medicare without an assessment?
So if your employer has an Advantage plan and someone moves onto that Advantage plan, they may not be able to get onto a supplement plan without going through a health assessment form.
Here we are trying to do.
Here we are trying to do something we've never done before. And so everyone's feeling a little squeamish. So when we call someone and ask them for information, do they promise to get back to us? Well, is this like, do they have 60 days to do it? Or in 60 days, are we supposed to have the new plan in place?
So I know that there was going to be an extended period where you can go and it should be up until January that you can apply and get coverage by January 1st.
Okay.
For the supplement plans, but it sounds like with your Blue Cross plan,
Yeah.
specifically, you might not have been dropped from that Advantage plan. So you might not have the opportunity to move over to a supplement plan without going through that health assessment form. And in that case, you would have to go before December 7th to try and apply for a supplement plan.
Okay.
In order to try and get it for January 1st.
Do they give us the price of the other plans so that we can see how much it's going to cost us?
So in regard to pricing on plans, the
Yeah.
best place to go is Medicare.gov, and you can see all the different plan pricings for both supplement plans, prescription drug plans, and Advantage plans. They're all listed on Medicare.gov.
Thank you.
But
Thank you.
for your particular plan, it sounded like you had an employer plan, and so that would not be listed on there. It's only plans that would be offered as kind of individual plans, not through an employer.
So then if I'm getting this through an employer, I should call the employer?
Yes, call the employer or call the company, and they should be able to look you up and be able to see what plan you're on. You should go to the customer service number on the back of your card.
Yes.
Yes.
Thank you.
Absolutely.
Okay, so before we do the final thank yous, just a reminder, if you want to watch this again and take your notes with you, type into your browser on your computer, YouTube, and then CSJ St. Paul, and this should be the first video that comes up.
Connor, thank you very much for this conversation. It's been valuable.
Thank you all for your questions. If you have any more questions, feel free to come up and ask.